Hi everyone, this is Harshita. Welcome to Teddy Guides You channel. So, from today onwards, we are going to discuss about kidney. So, it is the topic in the systemic pathology. In the last classes, I dealt about the lungs and anemias. If you not seen the video, please watch the video after this class. So, let's start the class. Systemic pathology of kidneys. So, let's start with the urine examination. In kidney, we come across many diseases. In the diseases, mostly you have to remember the microscopic features, electron microscopy features, and immunofluorescence. These are the important points that you must know in every disease. So, in urine examination, let's start with the microscopy. To remember this, I will give you a clue that is 3 C's. Like in urine examination, you can see cells. So, what are the cells you can see in the urine? You can observe RBC, WBC, and some of the inflammatory cells. So, there are the chances in which you can see these kind of cells in the urine examination. And second one is cast. These casts are compositions of TAM, horsefall protein. This protein is produced in the thick ascending limb of loop of Henle. So these are nothing but the cast. And the last one is crystals. These crystals are different in different situations and in different diseases. So these are the 3 C's you must remember. So now let's discuss some of the cases in which you can see different types of casts and conditions. First one is Highland cast. This is physiological. Like they can be seen in normal pregnancy, stress and fever. And the second one is waxy cast. These can be seen in wax, comes in the last row of the alphabets. So remember it like last means chronic renal failure. Next one is RBC cast. This is the nephron. RBCs are mostly present in the glomerulus. So any disease that is involving any disease in which glomerulus is involving has a chance of getting RBC cast in the urine. So the disease is glomerulonephritis. This is the disease in which the glomerulus is getting affected. Next one is WBC cast. This is generally seen in pyelonephritis. Next one is fatty cast, which is seen in the nephrotic syndrome. Because in nephrotic syndrome, you can see hyperlipidemia. So in that condition, you can get fatty cast in the nephrotic syndrome. Okay. So these are the points that are given in the Robbins. So now let's go deep into the topics. Now let's learn about some of the important crystals. So these crystals are also different types. First one is Stackhorn stones. These are also called as struvite stones. Second one is cystine stones. Third one is uric acid stones or crystals. Fourth one is calcium oxalate stones. And the last one is ammonium urate stones. So these are the kind of stones or crystals that you can observe in urine examination. So in staghorn stones, you will come across they are mostly present in the alkaline urine. Remaining all are present in the acidic urine. Okay, now let's discuss about the shape. The shapes are also very different. Like staghorn stones will be in rectangular shape or coffee lid appearance. Rectangular or coffee lid appearance. Coffee lid appearance. Second one is cystine. They are hexagonal in shape. And uric acid are varying shapes. Like the shape may be any kind. And whereas this calcium oxalate, calcium plus oxalate, the name itself is saying two components are getting involved. So it is dumbbell shape. Okay, so these are the points that you must remember. And it is also important for you to note which is radiopaque and which is radiolucent. Okay, now let's discuss about the kidney biopsy. So this is the image that I extracted from the Robbins. So now let's discuss them. First one, these are the structures that are present in the nephron. Nephron is the structural and functional unit of the kidney. So first one is the glomerulus. Next one is tubules. One is interstitium. The last one is renal blood vessels. For example, this is nephron. So here the blood vessel which is entering into the glomerulus is called as efferent arteriole. And the blood vessel which is leaving the glomerulus is called as the efferent arteriole. And here the structure is called as glomerulus. So this is the structure that we are learning about. And next one is tubes. Tubes, these are called as tubes. This is PCT, proximal convoluted tubule. This is DCT, distal convoluted tubule. And this is loop of Henle. So these are the structures that comes in the tubules, and this is collecting duct. And the surrounding space is called as the interstitium. These structures are called as blood vessels. So these are the structures that are present in the nephron. So in the kidney biopsy, we will see these structures. Now let's go deep into these structures. So now let's discuss more about the glomerulus. So glomerulus composed of a bunch of capillaries or tuft of capillaries. These capillaries are initiated by the efferent arteriole and ended by the efferent arterioles. Okay. So these are the two arterioles that are present in the glomerulus. Next one is Bowman's space or Bowman's capsule. So this structure is called as the Bowman's capsule. Okay. This Bowman's capsule is made up of two layers. First one is a two epithelial cell layers. Outer one is parietal epithelium. Inner one is visceral epithelium. You can observe here. Outer one is called as the parietal epithelium. This is the outer one. And the internal structure is called as the visceral epithelium. Between these two, Bowman's capsule is present. And these visceral epithelium contains food processes. These are also called as podocytes. Glomerular epithelium, like glomerulus, is normally formed by the blood vessels, and we know the normal blood vessels is lined by the endothelium layer, and it also covered by the glomerular basement membrane. So this is the glomerular basement membrane. This basement membrane is present between the visceral epithelium and the endothelium. For example, this is the endothelium. This is the endothelium. And this is the visceral epithelium. This visceral epithelium contains podocytes. Okay. And this structure is called as the basement membrane. So this basement membrane is present between the visceral epithelium and the endothelium. I hope you are clear up to now. So talking about this basement membrane, this basement membrane is very important because it's made up of type 4 collagen, laminin, heparan sulfate, and proteoglycans. So these are the proteins or the structures by which basement membrane is made up of. So in renal chapter, it is very important to know about the basement membrane, the structures, the location of the basement membrane, the structures by which basement membrane is formed, and the staining of the basement membrane. Okay. This endothelium, if you observe here, for example, this is endothelium. This endothelium is having fenestrations or some pores. This endothelium is having fenestrations so that some of the particles will move out of the blood vessels and enters into the Bowman's capsule. Okay. Now let's discuss the fenestrations. So for example, this is the basement membrane. So this is how the basement membrane is present. So this is the image directly taken from the Robbins. This structure is called as the glomerular basement membrane. So these are endothelial cells. And these are nothing but the podocytes. Okay. So these are the structures that are present inside and outside of the glomerular basement membrane. So glomerular basement membrane. Here the blood moves. The RBCs will flow here. So some of the particles from the endothelium, from the podocytes, will enters into the Bowman's capsule. So this is the physiology, how it happens. So it is very important to know about the podocytes. So podocytes are the structures to which the particles pass on. So these podocytes, glomerular basement membrane, and the endothelium, these three are called as filtration membrane. So this contains podocytes, glomerular basement membrane. The last one is endothelium. And the next one is podocyte structure. So this is the diagram again taken from the Robbins. Podocyte. See here. There are 4 different kinds of proteins. First one is nephrin. So this is the nephrin molecule. This is podocyte 1. This is podocyte 2. So nephrin molecule is present between the podocyte 1 and podocyte 2, indicating that this molecule is very useful for the joining of two adjacent podocytes. Okay. So nephrin molecule is very important to join the adjacent podocytes. Okay, so this is the first one. Nephrin is composed by NPHS1 gene, and the second one is podocin. So podocin is the structure that is present inside the podocyte. So they encoded by NPHS2 gene, and the next one is CD2AP. It is also present inside the podocyte, and the last one is actin filaments. So these are the different types of proteins one should remember regarding podocytes. Let me write them here. So there are 4 types of proteins. First one is nephrin molecule, which is encoded by NPSH1 gene. Second one podocin, which is present inside the podocyte and which is encoded by the NPSH2 gene. Third one is actin filament. And the fourth one is CD2AP. So these are the proteins that are present in the podocytes. And the next one is, here we talked everything about the glomerular basement membrane. And the last thing that you must remember is strain. And the strain is periodic acid skiff. So this is the strain that is useful to strain the basement membrane. So the color you get is magenta pink color. You must remember this for sure. Okay. And the proteins are also very, very important for you to remember. Nephrin, podocin, actin filament and CD2AP. Now let's discuss some of the important points regarding the filtration membrane. For example, for a particle to pass from the podocyte, the particle size should be less than 3.6 nanometer radius. So it can be easily filtered through the glomerular membrane. Second one is charge. The charge is also very, very important because the filtration membrane is negatively charged. So negative charged particles can't cross the filtration membrane. So the proteins are also negatively charged. So proteins can't pass the filtration membrane. So this is all that you need to know. So this is all for today. If you're not yet subscribed to the channel, please consider subscribing to the channel today, guys. This is K. Harshita signing off. Thank you so much.